Okay, hi, and welcome back, everyone. I just wanted to give you the coronavirus updates. So today is the 6th, and this is 2021. Now, as you know, my name is Markeitha. I'm the host, and you can reach me at my website, which is healthyliving.company. And there you'll see a list of my previous shows. You can also click previous tab if you missed the last show to watch anytime. There you also see that I have several products. I have Keita's Egg Toast, I have gumbo, and gumbo comes with hot water cornbread and rice. So I would prefer to make that for you fresh. So you can send me a message at my website, or you can contact me here at the Next Level Studios, and that's 310 549 1113. 310-549-1113. Now, please subscribe if you're a Facebook friend. Please subscribe to my website. You'll stay up to date to all the current information. The producer of the show is T Jams. That's TJAMZ. And you can reach him at tjamsmusic.com. There you'll see a whole list of songs he has produced. He also writes all the songs for the show. You can write lyrics to him and send him messages as well. You can also contact him here at the Next Level Studios at 310-549-1113, 310-549-1113. He also does web design. So there's a lot of things on both sites that you can search and go through. Now today we're going to talk about the coronavirus update. So it's still, even though they're reopening, you still have to be safe. It's not over yet. So I retrieve most of my information I get from CDC website. I also get the employment information for employees from the Cal OSHA website, as well as the Medscape for all my number statistics. Worldometer Medscape is a site I get from the medical stuff for corona updates. The Worldometer website is where I get the statistics. Okay, so for today, the 6th, this is worldwide. We still have people who are dying, and we still have people who are getting cases. So it's not over. This is still a pandemic. So it's not over. So worldwide, we have 173,913,068 deaths. We have more than 3,300,740,588. Now, there's several who has recovered, but you don't want to get coronavirus because there's a lot of problems, permanent problems you can get in your lung damage and different things, and they have long haulers that last for several months. So you don't want to get COVID in the first place. But the number of people that have recovered is 156,852,000 and 8,854. The U.S. is the leader in cases as well as death. For the cases, we have 34,205,248. Now the deaths is way past 500. Remember, I didn't think we would even get to this, but we're well over 600,000. So we have 600,012, 219 deaths. India is leading in cases. They're second leaders. They have 28,900,151. But they're the third leader in deaths, 348,923. Now Brazil is the third leader in cases at 16,907,425, and the second largest in deaths. Second largest in death. This is worldwide. 472,629. Now, the coronavirus is a severe acute respiratory syndrome coronavirus. Also, it's a new virus. So it was first identified in December 2019, but we still think it might have occurred sooner than that, like maybe October or definitely by November. It started in Wuhan, China. The World Health Organization declared a public international concern on January 30th, 2020, and later it was declared a pandemic on March the 11th, 2020. That means it's across the world. It has spread to 219 countries and territories. The outbreak was originally linked to seafoods and maybe live animal markets. Now, also according to Medscape, on April 29th this year in Saigon, a joint China World Health Organization study into how the COVID first started. They're trying to figure out the origin. Answers about the pandemic begin to be more rigorous investigation and require with or without BG's involvement. A group of international scientists and researchers did a joint study. They wanted to see the route of where we got this coronavirus. Cause of the COVID-19, they say, is involved with bats and other wildlife. Many territories suggesting, okay, animal to person. This is when they first thought it started. But then later it grew into a lot of different people. Then it became person to person. So you get a range of different types. You get mild to severe or maybe even death from the coronavirus. So it affects different people differently. Now, symptoms may appear within 2 to 14 days after exposure to someone who has COVID. Now, the incubation period, it's a medium incubation period that runs from 4 to 5 days, but most symptomatic people experience symptoms within 2 to 7 days. So you remember we had this concern about asymptomatic people spreading it to people because they don't know they have symptoms. Well, that still exists right now. People are considered fully vaccinated 2 weeks after their second dose that they receive. 2 weeks after receiving their second dose, either the Pfizer or the Moderna. Now, for Johnson & Johnson, it's a single dose, but it's still 2 weeks after that dose, whether it's the 2-dose regimen or the first dose regimen. If you do not meet those requirements, you're not fully vaccinated, and you have to keep taking those precautions because you're not. If you have any conditions or taking medications that weaken your immune system, you may not be fully protected, even if you're fully vaccinated. So you need to consult with your health provider so they can give you instructions on how to protect yourself. Now, people who have increased risk, they have usually severe illness or hospitalizations or death. Some of those people are likely to be typically 50 years and older, but the ones that are more severe is 85 and older. Now, there's usually medical conditions that makes your risk increase and worse different outcomes if you have medical conditions like chronic lung disease, cancer, COPD, chronic obstruction pulmonary disease. Because, you know, it impacts the lungs, right? So you have to really pay attention to those symptoms. Also, asthma, moderate to severe, intestinal lung disease, cystic fibrosis, pulmonary hypertension, dementia, and other neurological conditions. Alzheimer's, associated COVID as well. There's diabetes. Diabetes is 1 and 2 diabetes. Down syndrome, heart conditions such as heart failure, coronary artery disease, hypertension. Don't forget about HIV. Those are your weakened immune system diseases, right? You can also have problems if you have some kind of genetic disorders that you were born with. Prolonged use of steroids increases your chances because it weakens your immune system. Chronic liver disease, non-alcoholic fatty liver disease, that comes from when you are overweight. I mean, excessively overweight, you get fat deposits in your liver. And especially if you have alcohol-related cirrhosis, which causes the scarring in your liver. And once those scarrings occur, that's damage to your liver that you will never get back. Now, overweight and obesity is a problem too. If your BMI, that's your body mass index, is greater than 25 to 40, then you really need to stick to the end of my show, and I'll demonstrate some exercises that you can do to help you lose the weight. So you don't want to be gaining weight at this time. Pregnancy is another risk. Sickle cell disease and thalassemia is another form of amnesia. Solid organ or stem cell transplants, stroke, cardiovascular disease. Now, there's been an increase in strokes because the coronavirus tends to cause more strokes. So if you start having symptoms where you can't talk right, slurred speech, can't walk right, side of your face is drooping, or there's some numbness, or you need help, then you need to let someone know so they can get you to the ER ASAP. Because the faster you go, the least likely that those symptoms will become permanent or progress to worse and can cause death. So you want to go right away. Also, substance abuse, because you tend to not follow any type of restrictions or do the appropriate behavior when you're under substances. You just don't. Now, for children, they have the same risk if they have those medical conditions, but they also get something that's called multi-system inflammatory syndrome, which can cause serious illness and death. And you're watching that how it's increasing with teens and young children that occurs with them. So if they start having symptoms, watch your kids, especially the young ones. They're holding their stomach. They're probably in pain. If they have redness in the palms of their hands and feet, rashes, if they have a thick, swollen, red tongue, if they're not eating, if they're hard to wake, if they feel tired all the time, kids don't feel tired. Then you start looking at your child and make sure you watch closely and consult with your primary. But if they're having shortness of breath or severe pain, you get them into the ER ASAP. Now, per the pbs.org website, fully vaccinated but feeling sick, you might need to have a COVID test. There has been some breakthrough COVID, even if you're fully vaccinated. On June the 4th, Dr. Afert Sawari is a physician associated with the professor of infectious disease and the chair of the Department of Medicine at West Virginia University. Imagine last night you developed a little runny nose and a sore throat. When you woke up the morning, you started coughing and you had fever. In the past, in years, your mind would say, oh, no problems, but now you need to immediately jump to COVID. Now, that was before you was fully vaccinated, right? But you still need to stay vigilant. But if you're already fully vaccinated, you might wonder, should I still be tested for COVID-19? Yes. As an infectious disease physician, I am often asked that question. The answer is yes. If you have symptoms of COVID-19, you should get tested for COVID-19, even if you're fully vaccinated. You won't be at high risk for hospitalization or severe disease, but if you are infected, you may pass the virus on to an unvaccinated person who could then get very sick. And also, if you notice, there's an increase in unvaccinated people going to the hospital. Why? Because they're not protected. So it's very important that you get vaccinated ASAP. Vaccinations work, but they aren't 100% effective. Researchers have developed some amazing COVID vaccine over the past year. The high efficiency of these vaccines in closely controlled environmental clinical trials matches their effectiveness in real life. So the things that they studied on is impacting the population right now, which is getting our cases down, getting our deaths down. So it is effective. The mRNA, which is in the vaccines of the Pfizer and the Moderna, is that it mimics that protein that's on the coronavirus cell. It remains over 90% effective in preventing hospitalizations or death. That does not, however, mean that you won't have the same degree of protection in getting infected. The latest research estimated that the mRNA vaccine offers 70 to 85% prevention from getting infected at all. So it does help, but remember, it's not 100%. It's 70, 85%. It is impossible to know whether a person is fully protected or could still develop a mild case if exposed to COVID-19. If you didn't happen to get infected, you could still spread the virus, and and that's why testing is still important. So if you have those symptoms, you need to get tested. What is breakthrough cases? This is when you're fully vaccinated, but you still get COVID. A person gets infected with COVID-19 after being fully vaccinated. This is called a breakthrough case. Breakthrough cases demonstrate a basic principle of infectious disease. Whether or not the person gets infected depends on the balance between two factors: the intensity of the exposure and the immune competence. Now, it depends on how strong your body has built up immunity and how strong you are. You can also take zinc, garlic, and eat avocados to help, and blackberries and broccoli. Those are some of the foods, as well as cashews and almonds, to help increase your immunity strength. So you want to do that as well. If you don't have those things, you can also take zinc supplements to help build your immune system, as well as B complex. Now, I recommend, if you're going to take zinc, make sure you do it on a full stomach, because it will make your stomach sick and make you feel nauseated. So make sure if you take zinc, you take it with a full stomach. Now, the intensity of the exposure is related to how close an uninfected person is to a highly infected individual spewing the virus while talking, and how long the person is in contact with that person. So you have to be at least 15 minutes or more in order to get the COVID, because you have to continue to get that exposure. People are in contact with them. Okay, immune competency relates to the body's inherent protection against COVID-19. Unvaccinated individuals who never been infected with COVID-19 have no protection. No protection. Unvaccinated people have no protection. That's why it's important to get vaccinated. Now, the virus, while fully vaccinated people will do much more to be, they are more protected than the unvaccinated person. So it's important to do that. Now, according to the CDC, as of April 30th, 2021, there's been a total of 10,262 known COVID infections that have what they consider breakthrough, meaning you're fully vaccinated, but you still got COVID. This happened in the United States and territories. CDC, they monitor where all of these viruses are, and they also give us instructions on what to do as far as to take care of ourselves that you have noticed. Now, there are usually asymptomatic or only mild symptom cases, and most don't result in hospitalization. Breakthrough cases will continue to occur, and these people are less likely to spread the coronavirus to others than unvaccinated individuals that still probably can. So the bottom line is, if you're fully vaccinated, you can get breakthrough and you can still spread. But if you're unvaccinated, you definitely can get it, and you get serious illness and go in the hospital, and you could potentially die. So it's a good idea to get vaccinated. And what about the SARS coronavirus variants? Now, they're still out there. We hear about them, right? So the world has fortunate that the mRNA vaccine is particularly afforded significant protection against those major variants so far, but there's some still breakthrough. They have, but entirely possible that at some point COVID-19 strains could mutate and particularly or fully escape the protection from the vaccines. That's why it's important that everybody get vaccinated, because the virus wants to survive. So what it does, it mutates because it wants to survive, so it gets stronger. So it's important to get tested. And if you feel sick, get tested. Even if you're fully vaccinated, don't blow it off, because you still could get COVID. As vaccination rates rise and daily cases counts fall in the U.S. and other countries, it is also important to keep a close eye on the coronavirus. This pandemic's not over, so you guys don't think it is. It's not over, okay? COVID-19 testing allows the officials to keep track of how much virus is in the communities, and positive tests that result from people quarantined before unknowingly spreading the virus to others. So yes, please get tested if you have any concerning symptoms. The nausea, the vomiting, the headache, the sneezes, the coughing, the sore throat, new loss of taste, of smell. These are just some of the symptoms, okay? Even if you're fully vaccinated, get tested. Now, according to Medscape, Delta variant dominated in the UK, may increase risk for hospitalization. This is a new mutant from the original UK variant. Now we have a Delta variant. Now this is according to the staff on June the 4th, 2021. So that's this month. This is new, and this has happened in London. According to Rutgers, the Delta variant of concern first identified in India is now dominant in Britain and might carry on increased risk of hospitalization compared to the Alpha variant. Public Health in England said on Thursday there was 5,472,000 new cases in the Delta variant reported in the latest weekly figures, taking the total confirmation of cases, the variant of 12,431, adding it's had overtaken the Alpha variant. That's the first one that was in the UK, identified in England, Kent, as Britain's dominant variant. So now we got this new mutant that has mutated on top of the mutation at first in the UK, that's now having significant breakthrough. The Delta variant is also thought to be more transmissible than the prior one. It's the Alpha. This one is the Delta. Now, Prime Minister Boris Johnson was warned that it could derail the plans to release the lockdown restrictions that he planned on ending on June 21st. So that's why I always tell people it depends on what's going on in your community, but you still have to be safe. With this variant now dominant across the UK, it remains a vital that people continue to exercise caution, particularly while you learn more about the transmission of health impacts. And Markeitha Harris, Chief Executive of UK Health Security Agency, early evidence suggested there may be an increased risk of hospitalization from this new Delta variant that's worse than the first variant in the UK, as known as, this one is B1617.2. So they attach different numbers to the different variants in order to keep track of them and identify them. Now this is compared to the original Alpha variant, which is the B117. So this one is worse than the first original variant. But more data is needed for more confirmation for the findings. They continue to be substantial increases in the growth rates of the Delta compared to the Alpha UK variant. So there still needs to for you to be very watchful. You have to be mindful of the different variants are out there. So I don't want you guys to let your guards down, because it's not over. And that's what I keep telling everybody. It's not over. So you have to keep watching. You have to make sure that you're wearing your mask. You're not grouping up in indoor activities without a mask, because the bottom line is you don't know who is vaccinated and who isn't. So that's a concern. So now we have this new variant that's out there in the UK that's worse than the prior UK coronavirus. So stay watchful, everybody. It's not over. Protect yourself, okay? That's why I'm giving you this update, so that you'll know that it's not over, and you have to stay vigilant. You have to stay vigilant. Okay, so officials previously said, the Delta could be from a few points of 50% or more increased transmittable than the Alpha variant, and extended that the average could be determined whether restrictions can be lifted in June 21st. So the Prime Minister has to relook at that to see if it still has increases of the coronavirus, in order whether or not he's going to lift the ban of restricting them in the home. So according to Jim Salter, on June the 3rd, Medscape webpage, the variant BAM for the coronavirus is also a spike in northern Missouri. This is a new variant for them. Okay, O'Fallon in Missouri, 2 neighborhood counties in rural North Missouri are seeing the increase in the COVID-19 cases spike, blamed in part of a new variant of virus, in part of the behavior of the residents, because they're not following the restrictions and the mandates of wearing a mask. Health officials in Lynn and Livingston counties are urging precautions to slow the spread of the virus. They are not certain residents will follow the guidelines. Both the counties lag well behind in the state national average of vaccination, so they're not getting vaccinated enough. The COVID-19 hub for the Missouri Department of Health and Senior Services on Wednesday showed Livingston County with 348 cases per 100,000 residents over the last 7 days, ending on Sunday, and Lynn County with 243,000 per 100,000 in cases. The statewide average for the period was 27 cases. 2 counties combined have 27,000 residents, both a little over 100 miles north of Kansas City. So look how close they are to Kansas City. Health officials in Livingston and Lynn counties blame variants on the virus first identified in UK and India. So it's already here in the United States. We already knew that. It's also pretty dominant in California. Now the WHO says that, meaning the World Health Organization, says both variants are concerning because they appear to spread easily. Sherry Weldon, administrator of Livingston County Health Department of Chillicothe, said that the outbreak spread has come not from any single event, but from several modest-sized gatherings. We're not seeing a specific hotspot. We're seeing several small churches. It came from churches and businesses. Might have a few, but also seeing a whole family, a husband, a wife, and 2 kids. And remember, if one bring it back, the others can get it as well. So you're talking about your whole household. Now, per Dr. Kendall Gino, Lynn County's medical director, also seeing recent cases involving children and even infants. So remember way back when it started last year, they said that children and infants and teens were at low risk. Well, that's no longer true. Now they're starting to have increased cases in children and infants because they can't be vaccinated at this time. So adults, you have to make sure you're vaccinated and you're doing safe practices so you don't bring it back to your children. Now, reinfections also are common. Gino said people who first came down with COVID-19 last year are getting sick again. So now it's recycling again, right? There's mutations. So you still have to practice the right protections because these variants are breaking through. So people who were sick before are getting sick again. The surge has not led to new deaths, but Gino said some people have had to be hospitalized. So that means the vaccine is not preventing their hospitalization, meaning severe illness. So even if they're vaccinated. So Lynn County Health Administration, Krista Niblock, said the variant spread because people refuse to follow mitigation guidelines, meaning wear your mask, stay social distance, wash your hands frequently. We have a large portion of our community that never want to wear masks. What is that about? It's not political, people. Wear your mask. It's safety. So she has a large amount of her population is not willing to wear a mask, and this is why there's increased variants, and now it's breaking through even if you're fully vaccinated. A large part of her community. Vaccination rates in both counties are low. 33.8% of their residents in Livingston County is 33.9% in Lynn County have initiated vaccination compared to 41.8% statewide and 50.8% nationally. So this is a problem for them. Livingston County Health Department is offering walk-up vaccine 2 days and week, and typically only 10 to 20 people show up. That is not good. We also remember I did another show where we had 93 million that got 1 shot when they should have got 2 shots. So remember, in order for you to be fully protected, you had to have 2 shots of the Pfizer or the Moderna, or 1 shot if it's Johnson & Johnson. But those 93 million were Pfizer and Moderna. So they are not fully vaccinated and they're not fully protected. We can't make them, she said. We encourage it. We're trying to make it easy for them. And you notice they're offering money and lotteries and different things to encourage people to go get vaccinated. Because the longer the large number of people not vaccinated, it's going to continue to mutate and it's going to continue to break through for us who are fully vaccinated. The Missouri Department of Health and Senior Services on Wednesday listed 36 additional deaths due to COVID-19 that was previously unreported. Now, we also finding out that there's a lot of unreported cases and deaths of COVID. It's happening so rapidly, a lot of people couldn't keep up, and they didn't have the COVID as the reason for the cause of death. Now we're finding out we're actually under the numbers. They included 1 death each September and November, each in January and April. January and April, they had 18 in March. All told, 9,122,000 Missourians have died from COVID-19, and 511,972 have been infected. So You guys need to increase your vaccination. You definitely got to keep your protection going because you don't know who's vaccinated and who's not. And you really, frankly, can't ask them. And at this point, some people you can't force them to get vaccinated. All we can do is encourage. According to Cal OSHA, that's the California Occupational Safety and Health Standards. This is for people who are employed and people who are working. Now, on Thursday, June the 3rd, 2021, Occupational Health and Safety Standards Board convened to vote on proposed changes of COVID prevention. This is their emergency temporary standards. The revision included updates for face covering, physical distancing, and other prevention measures for vaccinated and unvaccinated workers. Because when you go into the workplace, you don't know who's vaccinated. When you go to a place of business, that's a workplace. So you need to wear your mask. So be prepared and don't get upset when they ask you to wear your mask. It's not political, it's a safety thing. So don't get upset. Vaccinated and unvaccinated workers, they have to protect them. Cal OSHA is about protecting workers. Now, the emergency temporary standards apply to most workers in California. Upon approval of the Office of Administration Law, these new standards will be effective June 15, 2001. Requirements for workplaces still mean the place of business because they are workplaces. This is what's considered a work site. Limited purpose of COVID prevention regulations only mean like if you're in a building, a store, facility, agricultural fields, because usually there's a lot of people doing agriculture, right? Or other locations where COVID-19 cases were present during the high-risk exposure period. So that workspaces or indoor congregate settings, right? Meaning a lot of people are there and everybody's in that location and everybody's using the same bathrooms and lunchrooms. So that's why you have to wear your mask. And if you're going to be in that business, you need to wear your mask to protect the workers. Face coverings means a surgical mask, a medical procedure mask, a respirator worn voluntarily, or tightly woven fabric or non-woven material, at least 2 layers. A face covering has no visible hole or openings, meaning, let me show you right quick, because a lot of people wear masks, and that's why they recommend 2 masks, because the surgical masks or some masks have gaps, right? So let me show you right quick. So you put it on, right? You always put your fingers here to make sure you have a tight fit. But look, this part's protected. But look, there's gaps there. So you're not protected. That means it's getting in. So what they had been recommending is that you put another snugly fitting mask over the top. Right? So then there's no gaps. It's tightly fitted and there's no gaps. So you have to make sure that you're wearing the proper mask. Now, the respirators that they were talking about are usually the fit tested for employees, you know, where we have our faces are fitted for the N95. So this is one for me, and this means that it's tightly fitted. There's no gaps, there's no openings, so I'm not exposed, okay? So that's what they're talking about. Now, there's also there's some N95s available on the market, but there's also some K95s, right? So they're tight fitting. You do the same thing to make sure it fits, and there's no openings. So that's what's important. No gaps, no opening. Now, you have to make sure you're wearing it properly. You don't want to have it where you're not covering your nose. I see a lot of people doing that. You're not protected. Why? Because you breathing in through your nose. So you're not protecting yourself. So you have to make sure you're covering your nose as well. So those are the things that you have to do to protect yourself. Okay? So now they're saying that the standards for face covering does not include scarves. These are not appropriate. Scarves, ski masks, balaclavas, bandanas. So initially, we thought that bandanas was okay. But evidently, it's not enough protected layers, so you should not be wearing bandanas and scarves. So that's going to not happen anymore. So make sure you don't wear those. I don't wear those, but I did demonstrate because early on, several months ago, it was okay because you need to have some type of covering. But now we find out with research, that's why things change and you have to change with it. No more bandanas and scarves. Also, there's turtlenecks. People pull up a turtleneck to cover their mouth and nose. That's not good enough as well. Collars or single layer fabric. So those are no longer good enough. Fully vaccinated means employees has documentation showing that the person received at least 14 days prior either a second dose in the 2-dose COVID vaccines or the single dose that was approved by the FDA for emergency uses. They're working on permanent approval now. So this is Cal OSHA is saying the same thing about fully vaccinated people. You have to have 2 doses of Pfizer or Moderna or the 1 dose of the Johnson & Johnson, and 14 days after you receive that second dose is when you're fully vaccinated. So if that's not you, then you're not fully vaccinated. You need to continue to protect yourself. Now, the employers have to implement screenings for the employers, the employees and customers that come in. So each employer has to implement and develop those screening tools. Why? That's to ensure that their staff are safe and that they don't get COVID. So like I said, when you go into these businesses, have your mask and don't be upset if you have to wear your mask, because businesses have what? Employees. So Cal OSHA's developed the standards to protect those employees. So don't go in there and get upset, or don't go. Order online or do some other things, but don't go in there and then get upset, start in trouble because you don't have your mask and they ask you to wear a mask. Don't do that. It's not political. Employees will develop different policies and procedures effective immediately for individuals at the workplace to reduce workplace possibilities of getting COVID or getting sick. This is going to happen. So it doesn't matter if it's reopening in some places. If you're outside, not a problem. Unless you're cluttered together, there's multiple people in a section, you still got to wear your mask because it's too many people together. But indoors is a problem because it's indoors, and that's when you definitely need to wear your mask. And I will wear it too. Make sure you have no gaps on the side like I just showed you. Now, CDC says when you're fully vaccinated to protect yourself, updated on May 16. Choose safer activities. Like I say, consider what you're doing before you do it in order to make sure you're safe. If you are fully vaccinated, you can resume activities that you did prior to the pandemic. But remember, you need to be around fully vaccinated people. It has to be safe. You can not wear a mask if you're indoors with fully vaccinated people, but you have to know if they are or not. So if you don't know, then you need to wear your mask. Some exceptions are required. Now, if you go to federal, state, local, tribal, territorial laws, rules, and state regulations, and local businesses and workplace guidance will still remain in place. Why? Because they have to protect their workers and they have to protect people from large numbers getting sick. So just know, just because reopening, you still got to follow the protections. This is the Cal OSHA requirement stated earlier. I believe that we should continue to wear our masks because we don't know who's fully vaccinated or not. And asking people can stir up angers, especially if they're not fully vaccinated. And they can tell you they're fully vaccinated and they really are not. So what difference does it make? You just need to protect yourself. That's the bottom line. We are still learning how effective the vaccines are against variants and variants against the virus that cause COVID-19. Early data shows vaccination may work against some variants, but could be less effective against others. So this is also Cal OSHA saying the same thing that I had read to you earlier. So all the main regulatory bodies are saying the same thing. Have you been fully vaccinated? In general, people are considered fully vaccinated 2 weeks after the second dose. they say you have to tell people things 3 times before they finally get it. Well, this is the 3rd time. So you have to have 2 doses, the Moderna or the Pfizer. Or you have to have 1 time, that's the Johnson & Johnson. So the 93 million of you that only have 1 dose, you need to go get your 2nd dose in order to be fully vaccinated. Otherwise, you're not fully vaccinated. 2 weeks after that 2nd dose, okay, you're fully vaccinated. So what we're going to do is I'm going to take a break. And when I come back, hang in there with me because I'm going to show you some easy motion exercises. Exercises you can do lying, sitting, and standing to keep your weight down. Because remember, weight is a risk factor. So I'll see you in a couple of minutes. All righty. I'll see you later. Come back. Make sure that hip is over, right? And then you can go to the back. Make sure that hip is over. And you can do 3 sets of 10. Now remember, this is on both sides, not just one side, on both sides. I'm just doing it for demonstration purposes. You gotta do both sides. And the thing about it is you have to rotate your exercises that you do because your body get used to certain exercises. So I'm giving you several different options so you can rotate them around. Now, while you're here, you can hold your abs in, do your scissors, right? Do your scissors. You can also do lifts, low, medium, high. Depends on where you are until you can go all the way, right? So it just depends on what level you are, but at least you have a starting point, and then for more resistance, you hold your ab in and you lower your leg very slowly because that puts more pressure and requires more effort on your abs, right? So you can do that. And then you can do individual lifts as well. And like I say, if you're beginning, you can start low and then do higher, right? So you can do those things. Now, another thing you can do, turn over. And so this position, turn over, and what you want to do is lift your heels. Right? And if you can't lift them too high, go where you can go until you can go all the way. Now, the other thing, if you have knee problems, you may not be able to go but a fourth or halfway. Depends on the pain in your knee. But this is for the back of those thighs and buttocks, the cottage cheese. That's what this is for. Okay. So, now, let's do some standing. Okay, so standing, there's several you can do. Now you want to make sure you get hold on to your dresser or your bed. You don't want something that's going to move unless you're strong enough, because you're going to have to hold on, right? Because you want to make sure your core is getting strong. So you want to help develop it. So what you want to do is you want to be able to hold yourself up on one leg, and what's going to be working is your thighs, your buttocks. That's what's going to be working for you, okay? So you want to do it for 30 seconds. Now, I couldn't do it at first either, so don't feel bad. You may need something to hold on to, but just keep trying it and do it on both sides. That helps to develop that core, which is very important, to develop that core. And the fat that's around your waist is the most unhealthiest, so you want to get rid of that. Now, also remember, everything is both sides, but I'm just doing this for demonstration purposes. You can also, hold on, you can do leg lifts. You can do low, medium, and then high. And remember, it's both sides. It's always both sides of everything. Okay? So, now, another thing you can do is squats. So, for the squats, if you're having problems with your knees, then you want to go ahead and sit backwards, because then that takes the pressure off your knees. So you want to put your butt out and go down, right? And if you can't go all the way, go where you can go until you can go down all the way, right? And then come down. Now, if you don't have a problem, then just go ahead and do your squats. Now, the other thing that you can do is, I call these standing sit-ups, but they're really just bends, right? So you can have the same broad stand, and you can go hold your ab in and go down slowly. If you have back problems. If you don't have back problems, then you don't have to. And if you can't go all the way, then go to your knees, go to your calves, your ankles, the top of your feet until you get to the floor, right? So you do that. Remember, if you have back problems, you got to do it slowly. like so. Don't go too fast, right? Now, to mix it up, you want to go to the sides. So, you're going to go to the side, go to the middle. Remember, you're working your arms as well. Notice my arms are up and down. You're going to work in them as well, right? So that's what you want to get to, those exercises. Now, another easy way to squat is to use a chair. Or say, for instance, you have to make sure that your chair is not going to move, or your bed is not going to move. Your bed isn't, but the chair, make sure until you get strong enough. Or if you're at work, you want to take a break. This is a good exercise to do. So, you just sit down and you get up, right? That's a squat, a supported squat. So you just get up and you sit down. Get up and you sit down. Those are simple squats you can do. And depending on where you are, you can raise your chair higher to make it not as hard to go down on the squats. So you can do that and you can make those adjustments. Now, when we're sitting, we can do the same thing. We can still do, like I said, you can do them lying, sitting, or standing. You gotta target this ab, right? You gotta target, you gotta get rid of that crap. So, what you can do is open your legs and reach and go down. The same thing, right? You go down, and if you can't go all the way because your abdomen is in the way, then you go where you can go, whether it's your calves, your ankles, the top of your feet, or if your back is bothering you, then you're going to make sure you go slowly if you have back problems, because you want to see where you are with that. So I don't want you to go really fast if you have back problems. Just take it slow. And then what you want to do is move your feet in a little bit. And we want to go to the side as well. So we want to mix it up, right? But don't twist. Reach. And that's for those love handles, right? So that you can do as well. Now, again with this inner fat here, right? This inner thigh. So you can open and close, right? And you can do the same thing while you're lying as well. You know how we did the pelvic tilts? Okay. Well, we can do the same thing while we're lying. We just open our knees and we open and we close. Now, if you want some resistance, then you put on your resistive band. And then you can even open wider with your resistive band to make it more difficult once you get into it. And then you can open and close that way. So the wider you get apart or the tighter your band is, the harder it is for you to do that, right? Okay, so that's another way you can do that. Now, also, you can do, why you can get some weights and you can do, lift on your toes, lift them up, lift your feet up while you work in your arms, right? Because you want to make sure that you're moving a lot, holding your ab in while you're doing everything, hold your ab in, right? If you don't have the weights, no problem. What you can do is you get you some water bottles and do the same thing, right? Canned vegetables, you can do that as well. Anything that gives you a little weight so that you can do what you need to do. Now, if you have shoulder problems, then you might have to support them like I'm doing on my knees. But if you don't have a problem, then you can do full curls like so, right? Because according to my son, he exercises all the time. He said that's more effective if you do that. Now, I can do it with lightweight, but I have 5 pounds that I'm working with, and it makes it difficult for me. So you might have to adjust your weight depending on what your limitations are. And again, I usually do with my arm. If I'm doing my arm curls, I usually do at least 7 sets of 70. Now, I didn't get that up front, so do 3 sets of 10s until you can get there. Because if you're not used to moving, you're going to get sore. Trust me, you're going to get sore. But the important thing is that you're moving. And if you are getting sore, then that means you're moving, and that's a good thing. So just stay with it. Just keep those exercises going, right? So then you can also do the leg lifts, low, medium, and high, right? You can do those as well. And then you can also do them together. You can sit down, you can do your lifts together, together, low, medium, or high, right? Or you can hold it and hold your abs. That's isometric, right? It's holding it, right? So you can do that for 30 count or 3 sets of 10. Those are all still good things for you to do, right? Now, as far as what you can also do with your arms, you can get a band and tie it in the middle. So you have 2 loops, so you can put your arms in your hands. So what you can do is you can work your arms by exercising using curls as well. And you can rotate, do the same thing. Now, if you want to have more resistance, you open the legs wider, right? It's going to give you more resistance, and you can do it that way. So there's many ways you can do it to get more resistance and more strength. But the bottom line is you want to keep moving, right? Now, the other thing you can do while you're sitting, you also have the 4-point lift, where you can lift your leg, pull it out, bend it, and lower it down. And while you're doing this, make sure that you're holding in your abs while you're doing it, right? Right? Now, if you're, say, for instance, you're just bored at the doctor's office while you're waiting for your doctor, you can always just hold your legs up together, pull your abs in, and you can just extend your toes. Do 3 sets of 10, and you should be able to do a little bit more. Or you can count to 30, do 3 sets of 30, or 3 sets of 20s, or 3 sets of 10. Just depends on where you are, and this will be good for that top of that thigh, right? And you can also do this at work. You could be working on your computer, and you can hold your legs up, and you can be doing this exercise. You can hold it still, but we're trying to get more bang for our buck, right? So why not straighten out your toes while you're holding up your legs? That's a good way to do that, right? Right. Now, another thing for your arms, for that back of that arm, you can raise your arms up, and you can do this for the back of that arm, right? But depending on your restrictions, you might have to be a little lower because you don't want to raise your shoulders up too high. So it just depends on what you have going on, right? You can do that for your arms. Now, another thing you can do while you're watching your favorite show, like Queen of the South, or if you're into superheroes like Superman and Lois, or the Flash, or any of those other villains, whatever your favorite show is, right? This is a cutie. It's a pet. You can get any pet one, though. It doesn't have to be a cutie. But it also has a tension monitor knob that you can make it more intensive, meaning harder to pedal. It has a speedometer at the top, so it lets you know how far you went. So while you're watching your favorite TV program, this is usually when I do my 7 sets of 70s while I'm pedaling, right? Because remember, I was saying that you want to get more bang for your buck. So you want to work your arms and work your feet. Now, the good thing about this is you can also go in reverse. So you want to make sure that you're doing your exercises every day. So there's really no excuse not to exercise. It really isn't. Because you can do that. Now, one thing I'm going to tell you is that we have to make sure that also I want you to know that the coronavirus doesn't like acid. It really hates acid. So eating oranges, limes, and lemons, as well as avocados, it's a good acid food. Now you know that. Avocados is good for building immune system and it's good for killing the virus. So why not add these acid foods to your meal? Also pineapples, grapefruits, everything that's acid based, it's good. Coronavirus doesn't like it. Now another thing is that you can gargle in the mornings when you first get up, because you know mucus tends to settle in the throat. So cough, spit it out, never cough and then swallow. Spit that stuff out. And then gargle with mouthwash, because it's proven research that mouthwash does help kill some of the coronavirus. It sits in your throat and then it goes down into your lungs, right? So gargle every morning. Now, if you still, they still have, it still settles on items. When you get the groceries or the mail, wipe them down. You can get you some jars like this and put 1/3 bleach and the rest 2/3 water, and you have your own bleach spray. Because, they don't always have it. Remember before when they were running out. Or you can get some antibacterial soap and put it on a towel and soap it up and wipe it down that way. Don't rinse it out, just soap it up and clean it, right? So you still can do that. Make sure you're cleaning your cell phone every day because it has a lot of touches and people are not thinking about cleaning it. Research proving that you have at least 240 touches to your phone per day, depending on how active you are with your cell phone, especially you young ones. You guys can probably double that. So you want to keep your phone clean as well. Now, remember, wearing your mask, it's not good to wear the little scarves or the bandanas. It's not enough safety for you doing that. So get rid of that. You want to make sure if you're wearing the surgical mask, like I had told you about, that you don't have any openings. Remember, no openings, right? So here's the opening. See this opening? You don't want that. So what you want, you put another tight fitting one over it so it covers those holes, right? And then also, I have goggles. You can get fog-free goggles because they're entering through the eyes. And you can order those online. Make sure that they're not the vented ones. They're not the vented ones. They're indirect vent or no vent that protects you. Okay, so you guys keep protecting yourself. It's not over. The variants are out there and they're mutating and they're getting worse and they're having breakthrough. So continue to wear your mask, social distance, and wash your hands frequently. You can reach me at healthyliving.company, and there at my website I have the different products. You can see the previous shows by clicking on the previous tab. Watch anytime with your family. The producer of this show is T Jams, TJAMZ, and you can reach him at tjamsmusic.com. There he has a list of songs. You can write lyrics. He does web design. You can reach him at his website, or you can also reach him here at the Next Level Studios, 310-549-1113. 310-549-1113. Stay safe. Wear your mask. Social distance. You have to, because there's breakthrough coronavirus. There's plenty of people that's not vaccinated. So stay safe, and I'll see you in a couple of weeks. Remember, I always tell you the truth. Bye-bye. Take care.